Hello, I'm Dr. Joanna Penn on this warm and balmy night, and this session is for those with frozen shoulder, technically called adhesive capsulitis, or for those who have an achy shoulder, rotator cuff injuries, or problems that want a gentle warm-up before engaging in some of the strengthening protocol for the rotator cuff and the shoulder blade stabilizers. Okay, so a quick review of the shoulder joint. It is a ball and socket joint, so we have the socket and the ball, so it allows for full circumduction, but unlike the deep ball and socket joint of the hip joint, the shoulder joint is very shallow. So you've got this full range of motion in the shoulder joint that dancers, acrobats use quite a bit, swimmers, tennis players, baseball pitchers. You get a lot of range of motion with the shoulder joint, but with that comes a lot of instability. And oftentimes the rotator cuff, which are four muscles that provide proper gliding of the head of the arm in the shoulder socket, and they also provide a nice eccentric stabilizing of the arm in motions, can become irritated, inflamed, stressed, overused. The shoulder stabilizers are underused, and you get some irritation and inflammation in the joint. And this can sometimes lead to a rotator cuff injury, and in more severe cases, complete breakdown of the capsule with a lot of inflammation, known as adhesive capsulitis or frozen shoulder. So with no further ado, I'd like to go into these mobilizing exercises. The first one here, you're going to bend at the hips and knees, keep the spine neutral, so a little arch in the low back, support it with the abdominal wall engaged. And then you're just gonna do little circles. They can be super tiny. Like a pendulum, you just wanna start mobilizing the head of the arm in the socket. You can make them bigger if that feels good. You don't wanna push yourself. Irritation and pain are not necessary here. Keep them really small. Keep them relaxed. Very little muscular effort here. Perfect. After this, I'm going to take you to the wall, and let's say it's my right shoulder that's frozen or giving me some problems. I set a yoga strap around a curtain rod. Feel free to do the same or create something ingenious for yourself. And I'm going to hold on to the bottom of the strap with my right hand and just let it be passive. So I'm just going to grip with my hand and wrist, but I'm not going to engage my shoulder on the right side at all. And then I'm going to take my left hand, put it around the buckle, and pull using my bicep, lat, and pec, and let the right arm start to lift up. Maybe you stop here. Maybe you stop here. Maybe you feel good to continue further. You just want to go as far as you can go without tensing up the upper trapezius, right? We want to see if we can get motion just in the shoulder joint for the first 60 to 90 degrees. And then maybe the shoulder blade opens up away from the spine as you go past 90 degrees. Okay. Another variation on this is the finger walking, which is basically like itsy bitsy spider walking up the wall. Some people with frozen shoulder actually put marks on the wall, so each day they can see their progress as they go up. Or health professionals might have a little progress chart as well for their clients and patients. So those are 3 of the mobilizing exercises for you to start with. Now I'm going to come to a kneeling position, actually a seated position, and place my injured arm on this physio ball here. Then I'm just going to relax, let the weight of the arm sink down into the ball, and just do a little side bend in the direction of the ball. And then back up. I'm going to put my opposite hand, heel of the hand on the collarbone, fingertips on the top of the shoulder blade, bulk of belly of the hand can feel the muscles in between, and let those muscles relax. Even use the hand to kind of descend the scapula and collarbone down just a little bit, and side bend again. Right arm is completely relaxed. What you're doing here is passive range of motion or glide of the head of the arm in the socket. This is really what you're doing. but instead of moving the arm, we're keeping the arm still and moving the rib cage. So you just change the action by changing what part of the muscle or what part of the joint is stable and what part is moving, okay? So it's a pretty cool way to increase mobility. Again, do not do any of these if they provoke your capsulitis, if you get irritated or more inflamed and it inhibits your mobility the next day. You know to back it up, okay? So thank you for listening. I hope you found this helpful. I'm Dr. Joanna Penn. Bye-bye.